Every city has its silence, but in that silence, under bridges and in doorways, there's a hidden hospital with no walls, no waiting rooms, and no care. Here, chronic diseases are untreated, infections spread quietly, and hope slips through the cracks of broken systems. According to the CDC, people experiencing homelessness suffer higher rates of diabetes, hypertension, tuberculosis, HIV, and chronic respiratory disease. Yet they often lack the very thing these conditions demand most: regular medical care. Not because they don't want it, but because the system isn't built for lives lived outside. In some cities, over 70% of the homeless population has at least one chronic health condition. That's not poverty statistics, that's a silent epidemic. A 2025 study in the Lancet estimated that people experiencing homelessness lose, on average, 15 to 16 years of life compared to the housed population. 15 years stolen, not by a single disease, but by neglect, bureaucracy, and indifference. Because when you live on the streets, you can't refrigerate insulin. You can't keep antibiotics safe. You can't even make a follow-up appointment. Because you have no phone, no address, no transport. Hospitals were never built to be homes, but for thousands, the emergency room has become the only door left open. Every untreated wound, every uncontrolled blood sugar, every chest infection eventually ends up here, at society's last safety net. In the US alone, people experiencing homelessness visit the ER up to 5 times more often than the general population. And yet, they're discharged back to the same streets that made them sick. One infection heals, another begins. A hospital bed gives way to a park bench. The cycle repeats until someone decides to treat the cause, not just the symptom. Across North America and Europe, medical respite centers offer a different kind of care: temporary housing where patients can recover after discharge. Studies from the National Healthcare for the Homeless Council show these programs reduce readmissions by nearly 50%. They save hospitals money, and they save lives. In some cities, medicine doesn't wait inside clinics anymore. It walks the streets. Street medicine, teams that bring healthcare directly to encampments, are rewriting what compassion looks like. In California, India, and Spain, these mobile units are closing the gap, reducing ER visits and cutting hospitalizations dramatically. The failure isn't in medicine alone, it's in the policies that decide who deserves care. Evictions, criminalization of street life, long waiting lists for housing. These are medical conditions too, because they decide who gets to heal and who doesn't. The World Health Organization calls housing a social vaccine. You want fewer hospitalizations, fewer deaths? Then give people a roof, a door, a reason to take their meds. The Housing First model, giving people permanent homes before requiring sobriety or treatment, has transformed thousands of lives. In Finland, homelessness dropped by over 35% after nationwide adoption. People once deemed beyond help began managing chronic illness, finding work, rebuilding dignity. Housing doesn't just end homelessness, it ends medical chaos. Because health isn't only about medicine, it's about stability, safety, and belonging. Rosa's blood sugar is finally stable. Michael found a place to heal. Aisha hasn't missed a dose in months. 3 stories out of millions. Proof that compassion, when organized, can heal a world that's forgotten its sickest. Because when care goes where people are, lives stop disappearing.